Care Act reporting in Dynamics GP, and this webinar is going to be recorded, and we do share that recording with you as well following, so sit back and enjoy, and then also we will make sure that you get this information here from Nancy. Now, Nancy's been doing this for about 30 years, so maybe it's been longer, Nancy, since I've been working with you, and she is out of our Houston office, and so I'm very excited about having her here. She's one of her specialty areas is in the payroll HR area, amongst others. She probably can cover any other topic as well, but I'm glad to have her here as a subject matter expert. I'm handing over the presentation rights to you now, Nancy, and I can see your screen. So if you're ready to go, take it away.
Thank you, Kim. So Affordable Act, also known as Obamacare, has been with us a while, and now March 31st, originally they had said January 31st, we had to give the 1095Cs to the employees. They extended it to March 31st. So that is what is coming up on us. So what I'm going to do is I'm going to kind of do a general overview, and then I'm going to go right into GP and show you how and where and what in GP. ACA, what should we be aware of on the Affordable Care Act? Phase 1 is you determine eligibility and begin tracking. Phase 2, which is really where we're at right now, is reporting to the employees and the IRS. In GP, Phase 1 was included in the 2014 year-end update. Tracking should have begun at that point. If it didn't, that's okay. We can kind of catch up. It's included in Microsoft Dynamics GP 2013 or higher. There is no ACA in GP 2010 or lower. You need to not only install payroll, but you also have to have human resource management installed to use the ACA in GP. If you're a GP payroll customer, you will also own the HR module in GP 2013 and higher, even if you did not in past versions. What do you need to do to begin tracking? Well, first of all, to begin tracking, you need to have installed the 2014 year-end update. To print and run the 2015 1095Cs, you need to install, and that should be the January 2016 hot fix. Sorry about that. So you did, it would be the, so there was a year-end update that came out in November of 2015, and then in January a hot fix came out. And for GP 2013, it's version 12.002084, and for 2015, 14.000952. Make sure human resources is installed. Install the human resources in payroll suite if you want to use deductions in arrears. Deductions in arrears allows you to track uncollected deductions if somebody for some reason doesn't work or you're unable to collect the deductions at some point. Reconcile your benefits with payroll to HR, and I will go through a demo of that. And enter dependents and ACA information. You are only required to enter dependents for the ACA if you're a self-insured plan. If you're not a self-insured plan, you do not need to worry about the dependent information. So phase 2 is reporting to the IRS. First of all, who has to file? All applicable large employers, and that's known as ALE members. And so what is an ALE member? An ALE member is an employer that employs 50 or more full-time employees on average. And an employee is considered full-time if they work more than 30 hours a week or average of 130 hours per month. Jury duty, FLMA, holiday, vacation, sick, all are considered hours of service. So if your employee is 30 hours or more, they are a full-time employee for ACA purposes. When do you need to file? As we mentioned, you need to file to the employees by March 31st and to the IRS by May 31st or June 30th if you're filing electronically. For 2015, there was a waiver if you have 50 to 99 employees. Remember, if you're under 50, you're not an ALE and you don't even have to file. If you're 50 to 99 employees, there was a waiver, and for 2015, you do not need to file. Well, you do not need to give 1095-Cs to the employee, but you must file the 1094-C and sign the 1094-C and basically saying that you didn't decrease your workforce to get under the 100 and get out of this filing. For 2016, there is no waiver, and you will need to file. If you have more than 250 1095-Cs, you must file electronically. Dynamics GP does not do the electronic filing, and you would need to go to a third party, such as Green Shades or Integrity Data. Who gets a 1095-C? Goes to every employee who is eligible for company-sponsored health insurance, even if they waive it, and to every employee who is on a company-sponsored plan, of course. If you don't file, there's pretty stiff penalties, and these penalties were even updated last June, so they do mean business. So do need to file. Here is a sample of the 1095-C. You can see Part 1 is basically employee demographic information. Part 2 shows what months they had coverage. And then Part 3 is where you put their dependent information if you are self-insured. And one thing that's caused a lot of, and I'll mention it now, GP actually prints the form. If you're a long-time GP user, you know that when you go to print the W-2s, you have to buy the form at Office Depot or wherever and print the form on there. This actually prints the whole form, so you do not need to buy pre-printed forms. So let's talk a little bit about GP. I'm going to go through some screenshots, and then I'm going to actually go into GP and show it to you. First of all, you need to create a health insurance enrollment in the HR for each employee. Set up this form, and then down here in the lower left corner, you'll notice there's the Affordable Care Act, and then there's 2 boxes to complete what kind of coverage they have and what safe harbor rule they have.
Nancy, this is Kim. There's a lag.
And then this is the list. Yes.
I said there's a lag in what's showing, so we're still back on the form.
I'm sorry, what?
I said there's a lag in what's showing, so it's still back at the form.
Oh.
It was doing that for me too. I'm not exactly
right back here?
Sure. We're still looking at the 1095-C form.
Is there a way I can get it to move forward?
No, I don't know, because I noticed it when I was speaking too, that it was behind as well. So I will see here if I can find out through some of the settings or something, okay? So keep talking, but just so you're aware. Okay, now we can see your PowerPoint slide. We can see
okay.
We can see your part.
So this is the 1095, this is the health insurance, the enrollment form, the enrollment screen in GP HR. And as I mentioned, down here in the lower left-hand corner is the Affordable Care Act information. And I will actually go into GP and show this to you. Hopefully there won't be a lag when we go into the software. And then this included in this is a list of the line 14, and line 14 is basically saying this is a full-time employee with spouse and dependents or employee only, etc. And then the second one is what what is their safe harbor? The employee is enrolled in the coverage offered. employee not employed during this month, etc. This screen is showing the employee dependent information. Here again, just to reiterate, it's for self-insured employees, and you would go into the screen, fill out the information, and insert it in the line at the very bottom. Prior to printing the forms, you have the ability to edit them. And one thing I will mention, if you didn't start tracking in 2014, and I did mention you could catch up, I've noticed that people have had to do a lot of editing just to get this information exactly right for the past year, and this is where they do it. But if you get it going for 2016, then your editing a year from now will be much less. And I'll show you kind of how to edit and all that. And then here's where you print the form, and you'll notice you print the form right where you print your W-2, so it's not even another screen that you have to get used to, but it's right there. GP added a couple of new forms with this, and let me go ahead and go into GP. So first of all, there's a couple of ways to get your get it going, and one is to go ahead and set. If you're kind of doing it new, you could go ahead into Employee Deductions and Setup, and go to Health Insurance. And when I put in here that I'm doing a new insurance, and let's say I'm a biweekly payer, there's information I can fill out. I do need to fill out what type of coverage is this plan. I'm going to say it's family coverage. And then here, the contribution. How much does the employee contribute to this plan, and how much does the employer contribute? So if I say the employee's contributing $100 and the employer $50, just making up some numbers, then down here, Affordable Care Act, this is where I kind of move it every little update they do, but here's the offer of coverage. I'm going to say this is full-time for the family, and the employees enrolled and offered coverage. This lower cost of premium is down here. I'll come back to that in a minute after I save this. When I save this, you're going to notice two screens pop up. So first of all, I'm going to save it, and it's going to tell me that I need to save these in deduction setup. So I'm going to say OK. And what it's brought up my payroll deduction automatically. It put in the $100 that I said the employee is going to pay, and then I can put in the date this starts. Bi-weekly, I can even put in here box 12, DD, which would bring it over to the W-2 automatically. Once I save that, remember this is the deduction setup in payroll. It's going to next bring up the benefit, and I can set up the benefit. So once I set up the health insurance, it's going to automatically walk me through setting up the payroll deduction and the benefit. I want to go back to that insurance here. One of the questions on the 1095C is what is the lowest cost premium that an employee could have gotten just to cover the employee only, and that's the amount here. If your policy in your company is we pay 100% in the employee, then the answer right here is 0. If the employee has to pay $30 every 2 weeks, then the answer is $30 right here. This is the lowest cost that an employee could have gotten into the plan. Maybe there's several levels of plan and he chooses the highest. This would be if he chose the lowest one available. If you are already using payroll and have for years, and you've got your payroll and your payroll deductions and your benefits set up, then there's a syncing that can happen within GP. Now, in order for this to work, the health insurance setup in HR, the payroll deduction, and the payroll benefit have to be the exact same code. But if you've got a code in benefits and a code in payroll, it will automatically create the code in HR for you. To do that, you would go to Utilities, Human Resource, Reconcile. Utilities, Human Resource, Reconcile. There's two here. There's Update Benefit Setup and Update Benefit Enrollment. The first one you would want to do is Update Benefit Setup. What that does, and I'm not sure I have any to do, but I'll go ahead and do it. It will go through and find all the payroll deductions that you have in your payroll system, and it will create codes in the HR system. It will come up here, and this is probably child support, but let's just imagine it says insurance. Then you can go in here and choose medical. For child support, probably would have chosen miscellaneous benefits. But for all of your insurance, you would choose medical, say OK, and it will automatically create all of these in your HR system. Once you do that, now you've set up all your benefits. You've kind of synced what you have in payroll over to HR automatically. The next step is this box, Update Benefit Enrollment. So the first checkbox I did set up the code. That's it. All it did was set up the code. What this Update Benefit Enrollment will do is it will go back and find all your employees with that payroll deduction, and it will set them up in HR and sync them. So it's a two-step process. You do the first step first and then the second one. And it just goes through all your employees and tell me, probably that child support. I have some things that I haven't set up. So first of all, go through and create the codes, and then go through and set up the benefits. One important fact, which I just remembered, before you do the second step, before you do the Update Benefit Enrollment, come down to the left-hand corner here and update your user date to the start of the date you want to start tracking. So if you're trying to get out 2015, change this to 01/01/15 and do the reconcile at that point. For ACA, everything is based on your system date. So going forward, let's say you get everything set up for 2015, now you're into 2016. You hire somebody, now they're on insurance. Let's say here it is, March 17th, they applied for insurance, and they're in insurance starting February 1st. Roll this date back to February 1st and set them up at that point. It's a little bit kludgy, if you ask me, but it's all based on the system date when you set them up. So ideally, if you could, get in there and set them up, right when they get accepted for insurance, that would be the best. Same way if you terminate somebody, make sure the system date is the date when their insurance terminates. I'm going to discard that. Okay, so that's setting up, and really, honestly, that's all you have to do to set up. You just go in there, set up an HR code, and assign an employee to it. I can call up my employee Pilar. I can go to Human Resources Benefit Deduction. You can see this is sample data because she's in insurance and she's in family. So you can go into insurance, and under benefit status, you make her active. You have inactive, you have waived. If you have an employee who maybe is included on their spouse's insurance and waives it, if they're ineligible, if they're terminated, you have all these different codes that show the benefit status. Most likely you're using active, and then the date benefit begins would be here, but still that date, I cannot emphasize how important the date is in the bottom left-hand corner. So go through here and assign somebody. There's a whole bunch of other fields that may be used. You could put in who your coverage is with, what your group number is, what your policy number is, what your insured amount is. All of this information is optional, but filling out your Affordable Care Act information, your benefit status, and your benefit begins date is required. Okay, so that's all you have to do. Go in there and set it, and you're good until the end of the year. When you go in, you're going to do your typical year-end closing. I've already got it calculated, so I'm not going to do it again, to create your W-2s. Once you do that, you can go into Edit W-2s. And when you go in here, you'll see two additional boxes. If you have to adjust the dependents, you can do that there if you're self-insured. And then on the 1095, it'll come in here and it'll show. And this is kind of what I'm seeing, all based on what day you do it. You'll see, they're 1A and they're 2H or whatever, but for 1 or 2 or 3 months, it's none, and you have to go back and kind of edit those. I've done them with scripts. If it's a huge group, we can do it that way. But to edit, you would just go in here and edit each employee. And typically this is just the first year, honestly, getting it kind of synced up and what date you started it. Once you've done that, to print the 1095, you go to print, and here it is down here at 1095C. There's this checkbox over here. If you are a self-insured coverage, then you would have to check that. If you're not, do not check it. And then you can print your 1095Cs. And like I said, here's the form, and it prints it just like this. So you do not have to buy the pre-printed form. GP prints everything for you. And then there's a 1094C, which is the transmittal. 1094C is the 1095C, kind of like the W3 is the W2. And this is where you would print that form. This form has a little bit of more information. You might have to go back and check some boxes, but it will at least get you started. So basically, those are the steps within GP. Now let's see if I have any more slides. Oh, it's going to scare me if it's going to. There are some additional resources available. I mean, I mentioned earlier, if you do have more than 250, you're going to have to use a third party to be able to upload them to the IRS. And Green Shades and Integrity Data have a product. They each have a product, and they're very similar in what they do. In the ACA, it's basically two things. Are you providing all of your employees that are full-time employees insurance? That's the first test. And they do a test and alert you, hey, this guy, he was 25 hours, but he's kind of snuck up, and now he's a full-time employee. You need to include him on your insurance. The other part of it is, and you've probably done this with your insurance company, but it will also alert, there's the affordable part of it. When you charge the employee for their portion, it cannot exceed roughly 9.5% of their salary. So if for some reason the employee is not making enough, it will also alert you, hey, you've got this guy on insurance, that's good because he should be, but it's not affordable, so you're out of compliance at that point. So both green shades and integrity data will alert you if you have full-time employees that you don't have insurance on, or if they're not affordable. Just to give you a little, this is green shades. They call theirs the payroll inspector, and this is where they give you the alerts on the two things I just mentioned. And then integrity data, this is one of their reports. And you know, both of them are good because they give you documentation that you are adhering to the law. Yeah, and both of them have it, you know, they're roughly probably about the same price. It's just how you feel. Maybe you might already be using one of the products, or it's easier to keep in the same family. And they both have demos periodically, or we'll do them on a one-off basis. There's several blogs out there on customer source. And any questions? If you have any questions, I'd be happy to answer them. Kim, questions?
So again, on the right-hand side, there is an area called the question area. Type those in, and we've got our first one here. It is that amount per pay period? I think you were talking about some of the fees.
Let me go back to it, and we'll talk about, yes.
And let's take Dan off the.
Let me go back to Opolar.
Okay, and I'll also take Dan off the email here, or it's Dana, I guess. Let me ask Dana. Dana, what part of the presentation were you asking about the price on, Dana?
On the setup where you had the lowest premium?
I believe that is per month.
Okay, Dana, does that answer your question?
This lowest premium, this is what I've been noticing, is per month.
Yeah, that lowest cost premium right there. I was just wondering if it was per pay period, per year, per month, what amount we're supposed to put in that box.
Per month.
All right.
Now, this over here, the cost to the employer or the subscriber, that's per pay period. This is per year, per month, I'm sorry.
Okay.
Yeah.
All right. Thank you, Dana, for asking that question. All right, I'll put you back on mute here. Let's go to our next question. And it says, do you have to print the 1095s one at a time, or can you print them all at once? Brian asks.
No, you may print them all at once. When you and that does kind of bring up another point. Yes, when you go here and you print them, you can either print them. You can do either. You can print them one at a time, or you can print the whole batch. There is a little glitch. Well, let's call it a bug. That when you print it, it's printing everybody who you've ever had employed in GP. There is a script. And, you know, one of us can get you that script if you find you're printing, you know, 1095Cs for people that haven't worked for you in years. And it will clean out that, and it'll only print the ones for the people that are there this year. Hope that answers your question there.
Okay, that's a good answer. The next question is, we are self-insured and can't consistently get the employee name to print on part 3 of the form. Some print and some don't.
Oh, the employee, I guess the question is,
they're thinking it has to be with them being
is the employee
self-insured.
printing it? Yeah, but is the employee down there as self?
All right, let me get Nancy off of mute.
Kim, is that person on mute?
Yep, let me hold on here. All right, Nancy, can you ask the question again? Nancy?
I was wondering, is Nancy, there's two Nancys?
Nope, Nancy LaFleur.
Oh, Nancy LaFleur. Is the employee down here under self, under the relationship, I wonder? There's also, and I'm going to go out on a wire and look for something here. Trying to remember where it is. There's a checkbox. And that's one of the big no-nos, Kim, not to do this. There's a checkbox somewhere to auto-include the employee down. Default employee, there's a checkbox here. And Nancy, you might want to double check to see if that default employee info to dependent info is checked. And just to show you where I went to Tools, Setup, Tool Setup, System, Human Resource Preferences. And there is a preference to default the employee info to the dependent info. So I've got a feeling that for some reason that employee info is not defaulting down there, and that's why you're seeing it on some people but not others.
Okay. Hopefully that answers your questions, Nancy. I have a feeling she didn't have a mic to talk. All right, here's another question. Should all employees be set up with the health insurance deduction benefit even if they are part-time and not eligible?
Yes. There's a box there. That says they're ineligible, and on there, as you would say, the safe harbor code, you would say, you know, not a full-time employee or something to that effect, not an full-time employee during the month.
All right.
And you know what, that brings up kind of one other thing I want to mention, a little gotcha that I've seen. When you go and you know, you go to set up HR, and you set up the health insurance, like I mentioned when I did that new insurance. If I went in here and, you know, set it up and I don't have anything here in employee or employer insurance, it will not set up the payroll or the deduction. So if you think, oh, well, you know, it's all different for each one of my employees to pay based on what they, you know, choose, I'm not going to put anything in here. You know, put $1 or something in each of these, because what that'll do is it'll force the payroll deduction and the payroll benefit to be set up. If you don't put anything here, it assumes, oh, there's not going to be a payroll deduction, and it will not set it up. So do force it by putting a small amount on your setup. So I hope that helps.
All right, and here's another one. Is there a change proposed to not use the system date for ACA purposes?
Oh, I'd love to hear Terry Healy on that. I have not heard, they have not said. I would love for there to be a more user defined way of doing it. I have not heard of anything. I'm sure they were just trying to get through the first year of the law and that's been kind of a big deal, so hopefully they are going back and re-looking at that. I do not know that, though.
And again, that might be a good thing for everyone to put in Connect on Customer Source to do that and vote it up. That might be out there already, because that is how Microsoft does programming, is they look at the numbers. All right, Dana asked the questions, lowest premium on the setup screen. So I think that was a follow-up. All right, can you go back to the screen with the blogs or links? I wanted to jot those down,
Sure.
Nancy.
Well, I don't understand why I can't go to the last one automatically, but apparently I can't do that.
Why don't we end with that? I'll remind you to end
Kim,
with
are we
that.
going to...
Let's stay in GP here for a second, Nancy, because...
Are we going to be...
Let's stay in GP because we can end with that because we do have some more GP questions. Here's the first one. Can you show us?
And Kim, are we going to post the power?
Yes, we are. There we go.
Go ahead.
Oh, excellent. All right, so we will share the PowerPoint deck with everybody as well. Thank you. That's good.
Okay.
Here's one. Back to the product. It says, can you show us the 1095C edit feature again?
Sure. You go to Edit W-2s under Routines, and you go to 1095C right here, and it's right there. Was there a specific question regarding this, or just wanted to see it?
I think they wanted to know where to find it. And again, you can add more questions here. Another thing is, be aware that the Green Shades module for ACA does not support a 1-month measurement period. It only supports a 3-month or greater measurement period. I found this out after I purchased the software and am now going on to cancel my purchase. Okay. Have you heard of anything like that before, Nancy?
No.
Okay.
You know, in defense of all these people, this law has been changing. You know, it was changing monthly there for a while. I think it's kind of settling down, probably until after the elections, and it'll change some more. But yeah, it's been crazy. But I had not heard that.
Okay. Here's one from Amanda. It's 1094C on the IRS website has 4 parts, but the GP version only has 2 parts. Is there an update for GP?
I'm on the latest update, so no, I only have 2 parts. I'm on the latest update.
The question there, everybody, is
no,
Terry,
just 2 parts.
Back to those blogs. That's a good place probably for you to get any updates from Terry Healy on that. Or if you do need to find that specifically, it's T Healy, H-E-L-E-Y at Microsoft.com, and see if she can help you out there too. Terry's wonderful help. All right, here's another one. How do you handle employees who are related, husband and wife? One spouse is handling the coverage of health insurance as a family.
Oh, that's a good question. I hadn't gotten into that detail. I think I would still somehow. Yeah, I don't know. Anybody else having a suggestion? Please feel free to pipe in.
Okay.
I think, if they're a full-time employee, they have to be covered. Obviously, they are. I don't know if there was a...
But it's probably getting that report. Okay, here's one from Dana. It says, we have several plans. When setting up part-time employees who is not eligible, which plan should you use? And I think you already went through that, but maybe I'm wrong.
Yeah. you would set them up and you would put in there, ineligible because they're part-time, and then down here on coverage, it would be employee only. For no offer of coverage would be their, first one, and then their second one is employee, not a full-time employee.
Okay, good. All right, there are no other questions in the queue. Do you want to bring up your slide deck again, and let's just show them the blogs, because that's a way to get the latest and greatest information from Microsoft. That is very, very helpful. And also your contact information. While you're doing that, I guess we do have a couple more questions that popped in because people were probably waiting. It says, which benefit name would we use? Which benefit name would we use? That might be a tough question to answer there. Might want to get in touch with our support group. Here's one more. Since the instruction page also prints the 1095Cs, is there a way to print the two sides of, is there a way to print on two sides of the paper? Do you know if you can print on two sides? Nancy, is there a way to print the 1095Cs on two sides of the paper?
I don't know. That's a good question. I see where it prints the instructions. I guess that would be related to the your printer, where you would set that up to.
As two printers, try that.
On two sides.
Okay.
Yeah, that would have to be a preference, I would think.
Dana asked to be unmuted. Dana, do you want to follow up?
Yes, please. What I'm referring to in the setup is we have part-time employees who are ineligible. We have 3 different benefit plan names. Which plan name should we choose? Should we choose the one that meets the minimum requirements, or should we choose a different plan when we go to set the ineligible employees up? I know we're marking it ineligible, but we have 3 different plan names, benefit names.
I would probably
make a generic one
them up at the, I would probably choose the lowest plan to put them in as ineligible.
Okay.
I would probably choose that one.
Okay.
Yeah, I would think that would be the. Really doesn't matter because they're part-time.
Right, and they're not really eligible for any of the plans, so I didn't know whether or not we should set up something generic, just ineligible employees and put them into that kind of a field, or should we select one of our actual insurance plans?
I mean, you could you're thinking set up a new plan that says ineligible employees. That would help you track them. You could find out everybody that's in that plan. Either way.
I could see that being handy if you have a lot of employees.
Yeah, and you want to find out who.
1,800 plus. Okay.
And then you would have to inactivate that and put them into a new plan when they become eligible, if they become eligible.
Yes, but that would be a way of, I think, help tracking also.
Yeah.
Yeah.
That's a good idea.
Yes, I agree.
Okay, let me go back to questions. Just put you back on mute there, Dana. Let's see here. All right, hold on for 1 second. That's it, Nancy. So again, you want to bring up the final slide for contact information if they've got specific questions and need help. This was very, very helpful, enlightening. Again, this is really, really important, and nothing is more important when it comes to our payroll, right? And so it is important. We've got some experts on hand like Nancy that can assist you. So do keep in touch. Nancy, any last words of advice before we let folks go?
No, I just thank everybody for attending. It's been a It's been quite a year learning this as we go, and with it changing constantly, as I'm sure y'all are in the same boat. But thank you very much, and hope all goes well for y'all.
Sounds good. Now we will get a copy of this recording out to everybody, and so we will do that. And then also on top of that, if you need the slides right away, you can get in touch with Nancy here and she will get those to you. Otherwise, you can expect that with the follow-up email that comes out with the recording, okay? Thank you, everybody.